And right now we're talking about your health. We're talking about how to take care of your liver disease in Kenya, the hidden pandemic. It's been listed as being one of the most catastrophic, one would say, in the country today. And to have that discussion is Dr. Christopher Pio, who is a gastroenterologist and hepatologist at Aga Khan University Hospital. Hey, Daktari. Karibu.
Thank you, and you're all welcome.
Yeah, I hope I have not butchered the names.
I think you've done well. In fact, I want to keep it to a minimum.
Okay. And we also have Ann Loko, who is a liver transplant recipient at Litax. Karibu sana.
Thank you very much.
Every week, we go to a different African country. Yeah, how we go, don't worry, but we just go. But now with fuel prices, traveling will be a little bit difficult, but Sagod will provide. Now, we are in Djibouti today. A few things about Djibouti. They just got off an election, elected the president for the 6th time. Their population is 1.1 million. Very small country. Yeah. And you look at what feeds the country mostly is their port. Yeah, so it is the entryway of services and goods to Ethiopia, former colony of France as well. So they speak French, but traditionally they are majorly a Somali-speaking country. So their ties with people of Somalia as well is in there. But the proverb that we do get from the people of Djibouti says, a person who has not traveled has no eyes. A person who has not traveled has no eyes. How would you interpret it? What do you think people of Djibouti are saying? Ladies, go first.
That travel opens your mind.
Mm-hmm.
Yeah, you're able to see a lot that you didn't see if you stayed in one place.
Yeah. Short and sweet. Daktari.
Exposure helps. It enriches. And traveling is just part of it.
Yeah. I think as we get into this conversation, Dr. I'll start with you. Gastroenterologist and hepatologist. Earlier, he said all he had was just yeast. Now, please explain to us, gastroenterologist and hepatologist, what do they do, Doctor?
So, gastro relates to the gut. Enterologist means that ologist is basically the study of and enter means the intestines and all the rest. Okay, so that's basically it. Hepatologist comes from hepa, which means liver. Okay, as simple as that. So you just add the gut to the person who studies it, and you have those terminologies. So it's not complex, just
so it's just it's just how you name it is what makes it sound a bit tough.
Yes.
But then as we talk about liver disease in the country, what are we looking at? How bad, how good is it?
I think it is a neglected disease, in my opinion, from all aspects, both from the epidemiological aspect, because you need to know what are the statistics. Do you have a program for generating full statistics? Yes, we do have. There are statistics out there that state liver disease is one of the top 10.
Yes.
You can always look that one up. But the details regarding what this disease is and what the impact is on our communities is insufficient, I would say. So if you don't have numbers, you cannot take action. But again, if you look at the impact of the disease, I would say, let's take, for example, alcohol use disorders. If we took a tally of how many patients are being admitted for alcohol use disorders and how many of them have liver disease, it is a problem. Okay. Let's take metabolic associated fatty liver disease. Okay. How many of us are overweight and obese in this day and age? And the more obesity you have, the higher the risk. In fact, for those who have morbid obesity, say BMIs, which is a ratio of the weight to the height, if you have morbid obesity, up to 100% of them have fatty liver disease and are likely to progress. let's take diabetics, okay, which are linked to hypertension and all that. Up to something close to 60% would have metabolic associated liver disease. Let's take hepatitis B. Okay, it's estimated maybe 3% may have it and so forth and etc. And possibly 20% will go on to develop complications. Then we go, the functions of the liver are to process food,
Yes.
for immunity, and for storage, and also for drugs.
Yes.
How many of us take medications once in a while? Let's take paracetamol.
Yeah.
Most of
If it is misused,
Yeah.
you can have liver injury. Okay. So there are a lot of conditions that are related to liver disease that may impact us either through our family or through ourselves. So we need to take that into consideration. It's not until it hits you and hits your family that you'll begin to discover that, one, it's damn expensive. Okay. Two, apart from expense, it will impact on your family.
Yeah.
And sometimes the treatments may not be optimal in our setting. So, and it's a little bit of a quandrum. I know I'm painting a
green
picture. But I think even well added. Ulrich. But then you talk about treatment, and that's where you come in. So you are a recipient of a liver transplant.
Yes.
How was it? How did it dawn to you that, hey, I'm not feeling well? At what point did it occur to you that this is a problem, I need to get it fixed?
For me, I didn't start out as I wasn't diagnosed with liver disease first. I went to a dermatologist because I had a skin condition, lichen planus. I was diagnosed, but when they checked my blood work, it was out of range. I was anemic. My white blood cells were off. My platelets were very low. They were 66. That is considered very low.
They're supposed to be like a good range.
so 150 to about 400.
All right.
And they were going down. So the dermatologist referred me to hematologist. Hematologist also discovered that I have an autoimmune condition. Then I was referred to another doctor, rheumatologist. First of all, diagnosed with lupus, and later liver disease. Yes.
How's the journey with that?
It was
so you've been told you have a liver disease.
Yes.
Because I'm asking that because there's an individual who's listening in and says that he went to a GP, a general practitioner, and was told you have liver disease, and that was it.
Yeah.
How was it for you after you've been told you have a liver disease?
I was in denial. I didn't know what to do. I didn't even know that because I had end-stage liver disease, that it requires a transplant. I didn't even know that livers are transplanted. I was that ignorant. And therefore, they need to create awareness of liver disease, yes.
I think many... Sorry.
But when I had to accept, I was told I need... because of the way it was progressing, it was progressing quite fast, and I had all the symptoms of liver failure. And Dr. will mention those symptoms. I had every symptom of liver failure. So I needed to do a transplant I did my transplant in less than 1 year of diagnosis. I was diagnosed in February. I did my transplant in February of 2021. Then did my transplant in February of 2022. Yeah, that's how it progressed.
All right.
So, sounds like a bad one, but is it because of late diagnosis people don't get to know? How does it show that maybe leads to the fact that you're not aware of it until too late?
Maybe I can mention something.
Okay.
That at first, the only symptom I had, I think I had it for a long time, was just fatigue. Fatigue that 8 hours work was too much.
Too much.
Like I work 8 hours, I'm so fatigued. Weekends, I just sleep. I was always tired. And I didn't know that is a symptom of anything. Until now I was diagnosed, and one of the symptoms is fatigue.
I think to those people who love to sleep over the weekend, it does not mean that...
No, that's not it.
To finish that, is it because there's not enough information, or is it because of our tendency as a people not to go for checkups, or is it because there's an incapacity to detect this?
All of the above. So the issue is, number one, you need to understand that when you look at the body, different organs have different attributes. So one of the attributes of the liver is that it can regenerate if it hasn't been beaten and so forth. So that is why we do living organ donor transplants. So you can split half of your liver if you're healthy and give it to somebody else. While for kidneys, they take one kidney, you remain with the other one, blah, blah. Of course, they can take half your brain or your heart or something of the sort. Yeah. So really the issue is the liver is set up to take a lot of insults. So it's not until you destroy a substantial amount, more than 80%, that you start to get symptoms and signs. So it's kind of late. The tests that we do, some blood tests, you may be able to pick up early. And of course, if you do certain imaging tests, you may also be able to pick up early. Sometimes what we do a liver biopsy, but nobody wants their liver poked. Yes, and it has some complications here, but it's really useful to guide therapy. So if you understand that, then you will know why most people present late. And in our setting, of course, with limited access to healthcare, limited information, education, and communication, and of course, poor surveillance systems, etc., and so forth, it's not a surprise that many people present late. And there are other complications like liver cancer. Most of the patients that present to us, 9 out of 10, it's already too late. You just have to say, let's go.
We can only manage it.
I can send you to the moon, send you to whatever. The outcomes are the same. And then there are those who present with florid liver failure. You cannot even move them out of the ICU. Immediately you move them, end of story. Okay. So sometimes when patients present late, especially for the acute or chronic liver disease, we say that please seek healthcare as fast as possible, because the 72 hours determines whether you
live or die.
Yes.
But
well, you know, first let me confess my ignorance, because I'm one of those who did not know that liver can be transplanted. I've always believed in the regeneration of the liver. I think, you know, and thank you for demystifying, Doc. This is the information that we do not have largely. Because as you say, you can transplant a kidney, fine, a heart, whole, not piece of it. But then when it comes to the liver, really, it's a new field where you find conditions coming up rapidly, like you mentioned, liver cirrhosis, the fatty liver, and all that. But unfortunately, now to my question is that the liver is always an affected organ. Mostly the other, conditions that have prevailed before. Before it is now fully affected. It's quite a resilient organ, in my opinion, Doc. I stand to be corrected. But then when it is affected, already one is in a critical or so condition that needs rapid intervention, which is not cheap. And perhaps that's why people shy away from tests, that could allow early diagnosis and perhaps cheaper intervention. So as we look at it, Doc, today, of course, there's a substance abuse which could cause. There are other conditions that could cause the same. But are there lifestyle choices other than the substance? Because our foods are changing. That's our organs in how they operate. You say they have different characteristics, also are changing. Are there lifestyle changes one would employ, one, to prevent the effect of the liver, or to improve just general wellness of the organs of the body?
Yes, there is a lot. The most interesting thing is that it's just where can one start? So let's talk about food. Okay. food, there's the good, bad, and the ugly. We all love our food. We jump onto it and so forth. So if we eat the wrong foods, what happens? It changes the general layout of our bodies.
Wrong foods.
Yes, and so forth. So wrong foods in wrong amounts, in quantity, in quality, and so forth. So the optimum diet would be so-called Mediterranean type diet, which is half vegetables with half fruits, then a quarter carbohydrates and a quarter protein.
Doc, are you going to tell that to people from Western Kenya who have to eat a lot of ugali?
Yeah, but if you ask their grandparents, that's what they used to do. Their grandparents, that's what for example, maize. Who introduced maize into
Portuguese?
This cabbage. Who introduced it? Was it there? No. Watermelon. You talk about watermelon. Well, some of you, when you were growing up, did you see watermelon? No. So these things are changing. Chips is there. Blah blah. Were there Irish potatoes in this country?
No.
So there has been a change, complete change. Yeah. Yes. If you went to Paris and so forth, you can see the way they eat their food, plenty of vegetables, blah blah blah, and etc. So I think diet is one thing. Then of course activity also helps, and then avoiding some of our nice recreational activities, like you go. Some of it is cultural to drink and so forth and etc. But of course, if that is abused, it causes problems.
Right.
Yes. So
what is the correct amount in that case?
So it's not one size fits all. Yeah. So
no, good to ask, because again, somebody out there probably is wondering. I probably can't do without a tipo.
So I just tell them that, hey, you make a decision, okay? If you know it's causing you problems, stay away from it, okay? That it's as simple as that. Yes. So it is legal. So what the heck? And in my opinion, people make money from it, etc. So I'm of the opinion that if you make money from something, if there are side effects, why don't we get that money and put to help those that need it? So let's go back to
right.
Yes. So the issue is we've talked about nutrition, we've talked about exercise, and there are certain diseases that are preventable. For example, hepatitis B, which you just take a vaccine and hopefully it can be eradicated. Hepatitis A, which is spread through water and etc. Alcohol, I've already talked. The solution is avoid if you might. Yes, that is simple. So overall, then for those you cannot catch, you can actually do blood testing and also non-invasive testing. And you can do your usual screens, for example, complete blood count and the liver test, just to see how things are going on. Then you can pick up on high-risk groups, for example, diabetics, etc., and so forth.
All right. So
is there anything genetic about it?
Just a follow-up to that. Now, one may do the mitigative measures, the preventive measures, but then a point will come where we have identified somebody who needs a transplant. Is the challenge the same in terms of organ compatibility? Like they say we see with the same thing we see with heart and kidney. It's quite a rigorous process to have the compatibility in transplant. Does the liver matter as much?
Of course, you have to be compatible with your donor.
Yeah.
And what in liver transplantation happens is that the liver has the right lobe and the left lobe. So as a transplant patient, you get the right lobe, which is the 60% of your liver, and then it regenerates, and the one for the donor regenerates.
Okay.
But before the transplant, of course, you have to do tissue matching. The doc can explain to match the.
So basically, it's blood group and other comorbidities. Of course, you can't transplant somebody who is HIV positive to another unless whatever and so forth. So it's basically blood group, and the uptake is a little bit better than the kidney. All right. Don't mention any more of heart. When you so kidney is the more and the other whatever. So the uptake is better, and in fact, the amount of drugs that you need to take after transplant far less than whatever.
All right.
And you can see, I've had patients, you see them before transplant, after transplant, you can't believe they're transplant.
Yeah.
They will just say, hey, and so forth.
Yeah.
You're looking good.
Yeah.
If
Courtesy
actually
of
you didn't know.
invisible illness.
Yeah. So, and I want to bring the aspect of you've walked in, you've been told you have kidney disease, a transplant is needed,
Liver.
right? Or liver. Oh, yeah, sorry, liver disease, transplant is needed. I want you to unpack
Yes.
how you dealt with that and the importance of having a supportive mechanism as you go through that process, because you need a doctor, right,
Yes.
who will carry you through that.
Yeah.
You need a family who will help you with that.
Yeah.
You need to equally
Finances.
identify a partner, a donor who's willing to donate their own.
Yes.
And there is also the aspect of finances. Just take us through that, because many are asking those questions like, how do you deal with that? Because you have a headache. It's
Yes.
already crazy, dealing with that. But here you are dealing with liver transplant. Take us through that. What's your story?
When I was diagnosed, first of all, I told you I was not diagnosed with
Yes.
liver disease
Yes.
first. I was diagnosed with other issues. So it was one after the other. So I have a skin issue, I have lupus, then I have now, I need a liver transplant, right? So at first I was in denial. And then the symptoms kept, you develop one today, next week, like today, you're itching, the next day, you have ammonia in your system that makes you go a bit almost crazy. You have hallucinations, the next day, bleeding. So the symptoms keep going.
Yeah.
But I had support. I had a lot of support from my friends, family mostly. It was great. I had great doctors. Maybe should I mention doctor?
Yeah.
I can mention my rheumatologist, Dr. Etao, very fantastic doctor who saw me through that duration of my pre-transplant care. So I had support all through. And when it came time for fundraising, which was the hardest thing I think I've ever done, fundraising is not the thing you want.
Yes.
Because liver transplantation is done in Kenya. So you have to first get a doctor, maybe in India, which was my first choice. So I had to identify a doctor in India, then now start looking for funds. That was hard, but I got a lot of support. Also then it was NHIF. So NHIF covers about 500, which is barely enough. I needed 35,500 USD. Just to cover
500, that's almost 4 million.
Yeah, 4 million.
Yes, just to cover for the transplant in India, not but the other costs like a place to stay,
Accommodation and all that.
accommodation. Yes, and then there's also a lot of paperwork. So because also because of there's lack of awareness of liver disease, so I kept looking for any patient and stuff. None. I couldn't find anyone with a liver disease. So I decided, let's form an organization. Group, So we have a support group called LITAC. LITAC stands for Liver Diseases and Transplant Association of Kenya. Then that creates awareness of on liver disease and transplantation.
Yeah. Doctor, how important is it for, you see, her story right there paints the position that we are in the country. So one would ask the question, are we able to do that today? Because you're speaking about 2022. Are we able to do these procedures in the country today? Have we invested in that, or are we still at the point where we can detect but we cannot assist?
So the fact that we refer patients tells you the story.
We don't have
Yes. So it's not that we don't have the experts who cannot handle that, but you have to set into place systems that are viable, and systems that can actually ensure that if you undertake this procedure, there's going to be success. You can just run into it and all your cases fail, which is not where you want. So you have to have the infrastructure, you have to have the systems. I do not know the status of the transplant law, and so there's a lot that one has to do. It's not that we are not taking care of the patients. We do not prepare the patients for this procedure. In fact, some of the patients that we have, by the time they go to India, the doctors, they are saying, how did you manage to
look this good?
With this, some of them, they would have been written off completely and so forth. And so we stabilize the patient, look for the donor, check all that, make sure the talk about finances, the legal aspects of who the donor is. So there's a lot that one needs to go through. And remember that when you get a transplant, more than not, we keep you in India for 1 or 2 to 3 months. Okay, just to stabilize. And did you like the food? The food is not bad.
Not at all.
Actually, asking, given what you're saying, what is the policy level intervention, or what is the government
position,
or the stakeholders? What are they doing? Because I saw from the stats, it's about 13,000 deaths annually in Kenya, which is quite high. What exactly is the government's role and the stakeholders to ensure that this matter is taken care of? Because it's a silent killer and it's such lethal.
I take it back to you. What is the population thinking about this?
Yeah.
Because really, I'm not government. I cannot speak for government. That is why we partnered with Anne and said, let's start a support group, okay, and take it to the people. Let the people understand and let us work together, because it seems systems are not moving forward as would want.
I ask this because you are a stakeholder. Because then what level or effort has been made other than the support group? Because you see, not many of us, actually until yesterday, I'll be very honest, I had zero idea about this. But what is the level of intervention from the capacity of a stakeholder to ensure that this matter is put to the government, so that it can be?
So the way we designed it, because the truth of the matter, if you do things wrongly, you can talk till the cows come home. We can discuss all these issues, but I'm not looking at that. I'm looking at long term. So I said, let's start with
support.
Yes, that is the way to start. Okay, because health is from. So when we start with the support groups, it's legalized and so forth. Then we say, hey guys, politicians, we want a budget for this and so forth. We have done this for some groups like hepatitis B across in other countries. It has worked. In fact, in the other one of the countries, we were able to block the budget because they hadn't through the support group. So from our experience, it works. Yes, because sometimes for some of these activities, you have to put money out of your pocket to run this. And remember, worldwide, as I say, liver disease is kind of neglected. They don't get as much money as other diseases do. I would say, what is the budget for management of alcohol-associated liver disease? Is there any budget?
No.
How much do we make from alcohol?
A lot. It's the biggest contributor to the economy.
And actually, there's even an allocation that should go to rehabilitation. But
maybe I can mention some proposals we gave to the Independent Investigation Committee on Cell and Tissue Transplant. It was sitting last year, and they were looking at issues to do with transplantation. And one of the key things we mentioned is that we need to have a transplant authority in the country. It is there, but it is now connected to the blood transfusion and So we need to have a standalone transplant authority to handle matters to do with transplantation. Yes, as a separate entity.
Separate entity.
Another thing we need is that we need to have a transplant registry. You cannot do advocacy without numbers. You need to say, even when you're working with government, without numbers,
so they start
you can't do much. Another thing we were talking about is expanding the organ donation criteria to allow non-family members to be able to donate, or even paired transplant, paired exchanges. That then increases the the donor pool, and you're able to get more livers. Another thing is that currently SHA is covering pre-transplant and post-transplant costs for only kidney patients. So we were saying a transplant patient is a transplant patient. So let's not just give that money to kidney transplant patients. Give to all.
Increase the scope.
Increase the scope so that all transplant patients have access to pre-transplant, because it's very expensive. Even a lot of mortality happens when you're just looking for money to do the pre-transplant costs. At that point, if you need a transplant and you don't have money, what do you do?
You have to look for the money.
Well, it seems like you're doing a lot of good work, and please keep up.
Thank you.
Because as Doc says, we have to start somewhere, and it's one life at a time, one successful transplant at a time, and then one legislation at a time to make sure you have, as a country, we have a system funding that is working, and hopefully these processes can start happening here in Kenya sooner, Doc, than later. But now the support group.
Yes.
Earlier on, you said when you are getting on with your journey, when you're starting off your journey, you could not find someone, even to talk about it. Like a lived experience.
Yes.
How is that today? Are there persons you've encountered after since you started this?
Of course, now because we have the support group, we have about 80 members in the group, and more join. So we create awareness on liver disease and liver transplantation, and just do a lot of advocacy work.
Wow. So, and with those numbers, Doc, are you confirming that all those procedures have happened outside the country?
I'm confirming that there's no transplant happening
in Kenya.
In Kenya.
I want to look at one of the things that you hear every day is, not every day, like numbers that you've come across is someone had kidney stones, right? Alienda akatolewa, they're good to go, But there are others that I've had who have gone through the procedure, but they come back with either recurrent condition as well, or it metamorphosized to be something bigger than what it was. Take us through what kidney stones are, because many would identify with that, and how do you treat it, and does it just end at nilitolewa hizo stones, now I am good to go?
So kidney stones are stones, period, finished, and there are different types that can occur within the kidney. Of course, we're not supposed to be talking about kidney, but it's the body, so I'll push you back to at least gallstones or something. So just a way about kidney stones, it's just changes in the urine that is produced. The urine remains there. It causes pools and causes stones. Of course, if you remove the stone, you're kind of cured of it. For gallstones, it's almost the same thing. Yes. So we don't remove all stones if they are not symptomatic, but the problem with stones is if they get blocked, they can cause severe infection, they can cause pain. If it is recurrent, then we recommend removing the gallbladder with the stones. But it's not done for everybody. There has to be a benefit over a risk, because all these procedures carry a risk.
So there is now the gallstones, kidney stones, and do we have an interconnectivity between the same? Because liver gets battering from other conditions. Do we see the liver as well getting affected by the kidney stones?
No, not really. Not really. So the question is no. But if you have liver failure, your kidneys are more likely to fail. In fact, most patients who develop kidney failure in the setting of liver failure, most of them pass on within 2 to 6 weeks. So it's not a good thing. Yes.
I want to go back. I want to go back to what you pointed out, especially some of the things that lead to a liver problem. And hepatitis B vaccination, it's now almost mandatory, I think, is it a mandatory vaccine? To start from there. And then secondly, a fatty liver disease, are we having a problem with obesity, and is there a way people who are overweight, and what is being done at least at a level where it can be able to help people to sort that out and avoid people getting to that point of liver problems? Then how effective then would it be that there's more information, especially there's a support group, I agree, but I'm looking at where, honestly, me and you all here want to believe you're informed, but clearly, Dennis, we were very ignorant of the fact that there's a problem.
Yeah, so for hepatitis B, transmission is mainly from mother to child in our setting. So the solution there is to vaccinate the baby at birth, and of course to test mothers during their pregnancy. And even though we think the vaccine may not work, we have other methods of reducing the amount of virus in the system, so that if everybody gets a birth dose, at least we are assured that we are going to reduce the number of babies born to hepatitis B. And of course, there are other areas where you may get it from horizontally through blood transfusions, but we test the blood, sometimes through sexual contact, but that is rare. In fact, I usually tell somebody, husband and wife, I say, hey, you find out that the husband has or the wife has hepatitis B, and the husband is or the wife is scared. I say, no. Most of the time, it's only 1 out of 10 that you may have cross-infection between the two partners. So hepatitis B, if implemented well, the vaccine, it has been shown to actually change the yes. Obesity, that is a new problem that is ongoing, and I think it speaks for itself. You can walk on the street and see. You can you can know how many meetings have you had here, or discussions about weight loss and etc. and so forth? So the discussion is ongoing. The solutions are a little bit problematic.
Precisely.
Yes. So I think the approach is it's all, in my opinion, it's almost like alcohol. Yes. So if we're going to sort out the two problems, we need to. These are my heretical views. We need to approach them in such a manner. Because you tell me, go lose weight. I tell you, why should I lose weight? I look good, I look funky, and so forth, etc. Or I enjoy my food, and so forth. So it's about behavior. It's about chronicity in change of behavior. But you have to put it in such a way that you don't impact adversely on somebody's life. So people have to approach it through a different I think route, I would say. So I think we'll discuss that for another time.
Yes.
Now, for a person who is maybe about to begin the journey or going through the process already, or somebody who knows someone, but they don't have access to the social support that you're creating, how do they find you? Where do they find you?
We are online on all social media platforms. I can share a number. You can join. They can call me through. I can give you the number.
You can say.
You can say
0721 388 31.
And again, what do you call yourself?
LEADTAC. LEADTAC is Liver Diseases and Transplant Association of Kenya.
Okay.
Yeah.
So, and I want to look at. Someone has asked us a question here.
Yes.
For someone who's gone through a transplant, do they live a normal life? Are you like on medication throughout the rest of your life? Or is it once you're there and you've gone through the processes after the 3 weeks or 4 weeks in India, 4 months in India, and you're back? Do you stay off medication, or is it a lifetime period of you being under medication?
Before you do a transplant, you must commit to management of the illness post, and part of that management is taking immunosuppressants for the rest of your life.
Okay.
Also doing labs like every so often to check your numbers. That is done for also for life. So there's that follow-up. Also, you need to keep your weight in check so that you don't develop fatty liver, which can cause rejection or other issues with the liver. Yeah. Also, you must take care of your health because
And you see, that is very critical, because then, Dr. you bring in the behavior that we have in the country and our health-seeking behaviors. You only go to hospital when you can't stay in your house, you can't move. We do not have the habit of going for checkups every other time. We are the kind of Leo,
don't fix it, it's not broken.
My boss has told me to go to hospital, or my mom has dragged me to hospital. My husband, my wife have dragged me to hospital because they're saying that I'm not well. How is that contributing to late diagnosis of these diseases?
I think it's contributing, and the issue of access or the incentive to seek health care, it's multifactorial. For example, if I don't have the money and I want to save the money for something else, I may not run to have the test, or I may have a fear that I'm going to do the test and I would come up with a bad
report.
Or if there's a bad report, I may have to change my behavior and so forth. So it's multifactorial, and it depends from community to community. So to address that, it's a little bit tricky. But again, I push it back to the community.
Yeah, I mean, I'm looking at it from a different perspective, because now we have Kenyans who are registering for SHA, right?
Yes.
And with that being there, SHA wants to be able to take care of its citizens, for taking care of Kenyans. Should there be then more conversation from the providers' point of view, encouraging more Kenyans to get out there so that we start speaking more on preventative aspect of medicine other than curative? Because if that came from SHA, Kenyans being bombarded with messages, being told why it's important, why it's critical, then we would see a shift in health seeking behavior, because first of all, SHA is making it easier and affordable for individuals to get there.
Yeah.
Should that be the direction that as a country, as a leadership, as ministry, we are taking towards improving on health seeking behavior?
I think prevention is what is key.
Yeah.
Because doing a transplant is like the last option. It is the last option. It's not even a choice you do. It's like it's life-saving. It's a life-saving procedure. So I think before you come to think of doing a transplant, I think there should be measures to ensure that it is treatable. You can prevent anything that is preventable. You prevent it. Yeah.
Well, Doc, earlier on you spoke about the gut, which seems to be the center of, like the epicenter of everything. Even when it comes to the liver, what you feed the gut is what the liver is going to process and break down. Are there foods that we could say are foods that are good for the liver, generally speaking? We've eliminated the don't, like the intoxication from whatever substances. But generally, are there foods we could say these are the good ones? For starters, as you do the exercise, also consider having a bit of this more than the other.
So I would just push it back. It's not one size fits all.
Correct.
Yes, and what I alluded to was that more vegetables, more fruits, other than more carbohydrates, proteins are okay, and so forth. So usually it's the carbs that and the fats that may cause issues. So that is what the coffee is good. It has shown to impact moderately on protecting the liver and so forth. But I think just as fatty liver disease is the main. Now we need to focus on I would say balanced diet.
There's a question that has been asked here, and maybe you could respond to it.
Yes.
In terms of having a transplant committee or a transplant act
Authority.
Authority is there, but then putting in place laws that would have more Kenyans at the point of death donate their organs. So organ donation at the point of death. Do we have such laws that Kenyans are aware of, that if I'm going, I can donate my organs? And Doctor, you can also chip in. Once one is dead, can their liver be used to help someone who needs one?
Currently, the law that is there only allows for immediate family, like your immediate sister or brother. It doesn't allow, it's not as expanded. You can't get a liver from your relative.
I can't donate for you? Okay.
The law,
Yeah.
it's in the law. Deceased donor, we are still lobbying for that. Yeah, so the law only allows for living donor, immediate family donation.
Doc, is that a conversation you should be having as a country?
Yeah, in other countries, if you take a cue from, say, Canada and in Europe, when you go visit your doctor, you can sign that in case I have an accident or in case I'm brain dead for various reasons and my organs, I can donate. Yeah, so that in the West has been established. However, you also have to look at the communities. Yes, cultural issues, so that has to be taken care of. You know, as Africans, we say, okay, I want to go with all my organs or something of the sort. So there has to be a change of perspective, and that is a lot that I think the social workers and etc. and so forth, the cultural leaders need to take into consideration so that it's acceptable.
And someone is asking about bone marrow transplant. Does that happen locally?
Yeah, it does.
Okay.
Yeah, so I think it's a much easier procedure to undertake than full organ.
Yeah. It's not all doom and gloom, I think. From what I'm feeling is, if there is enough information out there,
Yes.
and probably that's the work that now people, you become an ambassador when you learn such a thing, to help, propagate the message and be clear that some of the things we do put us in much risk that is very quiet and only shows up later. And I hope and pray that, I think over time, progressively, the policy will be available. There's an expansion of what can be done and more people to get to understand what it is, because from what you hear as it is currently, it's not very pronounced, and it's scary to know that it's so morbid and quickly turns into something negative and bad. But we can do much to improve the situation and give information.
I mean, how do we have these discussions beyond the studio?
That's what I'm saying.
Yes, so let me push it back to you guys.
You're pushing back a lot.
Yes, I have to push it back to you guys. So the key issue is, you are the media.
Yes.
Right.
Yes. Do you have responsibilities?
Yes.
Yes. So your responsibility, you're the experts in communication. We need your help.
Yeah.
Yes. You have to offer some kind of level of community participation. All right. Go beyond just sitting in front of this and say, can I link up with, say, let's take or something and say, okay, can we work on this or something of the sort? Can we profile it and communicate it in such a way and link up? They have a website. Why not link up with Star FM and SpiceFM and so forth, etc. Those are ideas people need to think.
Because I'm also looking at expanding the engagement further, because here we've talked about an availability of an act of parliament that would enable a deceased donor or someone who's brain dead to do what? To donate their organs. That shows where we are as a country to address a problem that does exist. How then do we also push the conversation with the legislators, with the government that be, to make it possible for these procedures that are done out of the country, management of the same is done locally? Because we found out $35,000 is expensive for
Very
Kenyans.
expensive.
So it must-
50,000.
50,000. So those are discussions that perhaps then together, especially from a stakeholder's perspective, and also from your organization together with the media, that we push these conversations so that to those whose backs stop with, right?
Yeah.
This is done locally. Would you reckon that would make it affordable for Mwananchi, and perhaps even more insight would be there because it is a conversation that is ongoing? How are we having that discussion with Parliament, with the government?
So I think in the next coming months, we had thought about having a white paper.
Yep.
But then since you're here, I say I'm pushing back.
Yep.
So when you get access to, because some of us are closed in our cocoons and so forth, when you get access to these guys that really make a difference, pose the question to them and tell them, hey, what are you doing for us? Sometimes you may have journalists who are working in the whatever of parliament and so forth. You pause and say, put them to the wall and say, get back to us. Can we have a sitting? Can we have whatever, even the town halls and so forth? Then we push them to the wall and say, can we have outputs on? So that they say, we'll get back to you on this. Then
let me push back.
Yes.
What's the progress with the white paper?
So white paper. So we have with the white paper, we already have a plan. Okay, we have discussed between the tech and ourselves, and so forth. So as when we have finished the World Liver Day, we have set it in as one of the outputs.
When is that?
So
the date.
So the date, we do not have an exact date because we have to. How long have we been made legal since?
Since last year?
Last year. Yes.
Okay.
So we want to. You see, if you're going to present a white paper, you have to have a roadmap. Okay, and a roadmap is, and you need to have a champion within the group. Yes. If you don't have a champion within the group. Whatever white paper you present will go to the so those are things we have to think about carefully. Otherwise, yes, it's a good idea, but we have to find somebody who is willing to run with the message and so forth. So
Asante sana. It's a good place to end the conversation. Time, unfortunately, is limited. We want to thank Anne Loko, who's a liver transplant recipient and from LeadTech, and Dr. Christopher Opio, gastroenterologist and hepatologist at Aga Khan University Hospital. So for the one who is asking where to get the Daktari's contact, we shall be getting the contact and connecting him with you so that you're able to get the assistance that you do deserve. We say Asante sana, and to everybody that has made this a success, Asante sana. It's Friday. Good Feel Friday. Enjoy yourselves.
This is the Situation Room, the only way to start your day.